Hello everyone. This is Silver Queens. Today, we're going to talk about hormone replacement therapy. Hormone replacement therapy is a treatment that can alleviate menopausal symptoms and provide various health benefits. So today, we'll take a detailed look at this topic and share information that might be helpful to you. Let's start with discussing the relief of menopausal symptoms. Hormone replacement therapy effectively alleviates menopausal symptoms such as hot flashes, night sweats, and sleep disturbances. Hot flashes are one of the most common symptoms experienced by menopausal women, characterized by a sudden feeling of heat in the face, neck, and chest areas, often accompanied by sweating. Hormone replacement therapy significantly reduces the frequency and intensity of these symptoms. Night sweats also trouble many women. Waking up drenched in sweat in the middle of the night decreases sleep quality and increases daytime fatigue. Hormone replacement therapy effectively reduces these night sweats, helping you get a good night's sleep. Sleep disorders are also a common problem for menopausal women, and hormone replacement therapy improves sleep quality, allowing you to wake up feeling more refreshed in the morning. Next, let's look at osteoporosis prevention. Hormone replacement therapy helps maintain bone density, lowering the risk of osteoporosis. This is particularly important for women who have experienced early menopause. Osteoporosis is a condition where bones become weak and prone to fractures. As the female hormone estrogen decreases, bone loss accelerates, posing a significant risk to women after menopause. Hormone replacement therapy supplements estrogen, helping to prevent bone loss and maintain or even increase bone density. This means it can greatly reduce the risk of fractures. Women who experience early menopause are at higher risk of osteoporosis because they have a longer period of estrogen deficiency. Therefore, hormone replacement therapy can play an even more crucial role in these cases. In terms of cardiovascular health, hormone replacement therapy is also showing positive effects. Recent studies suggest that hormone replacement therapy started in early menopause or before age 60 can lower the risk of heart disease. Estrogen has the effect of dilating blood vessels and improving blood circulation, which is beneficial for cardiovascular health. It can also improve cholesterol levels, potentially helping to reduce the risk of atherosclerosis. However, these effects are known to occur mainly when hormone replacement therapy is started in early menopause or before age 60. Starting at an older age might actually increase the risk of cardiovascular disease, so caution is needed. Therefore, if you're considering hormone replacement therapy for cardiovascular health, it's best to consult with a doctor as early as possible to determine the right time to start. Regarding cognitive function, while it's difficult to draw definitive conclusions, yet some studies suggest that hormone replacement therapy may help prevent cognitive decline. Estrogen plays important roles in various parts of the brain, particularly in maintaining the function of the hippocampus, which is related to memory. Some studies have shown that women who started hormone replacement therapy in early menopause had a slower rate of cognitive decline compared to those who didn't. However, more research is still needed in this area. The effects on preventing dementia, such as Alzheimer's disease, are not yet certain. Still, there seems to be a good possibility that hormone replacement therapy could help maintain cognitive functions like memory and concentration. Hormone replacement therapy is also effective in improving vaginal health. It alleviates symptoms such as vaginal dryness and painful intercourse, improving quality of life. During menopause, the decrease in estrogen causes the vaginal mucosa to thin and dry out, which can cause discomfort and pain. Hormone replacement therapy helps solve these problems by keeping the vaginal mucosa healthy and increasing vaginal secretions. This plays a big role in improving the quality of sex life and overall life satisfaction. It can also reduce the risk of urinary tract infections. Estrogen helps maintain healthy tissue around the urethra, increasing resistance to urinary tract infections. However, caution is needed regarding breast cancer risk. Long-term use of combined hormone replacement therapy may slightly increase the risk of breast cancer. Therefore, individualized treatment considering personal health status and risk factors is important. Breast cancer risk is one of the most concerning aspects when using hormone replacement therapy. The risk may be higher especially with combined hormone replacement therapy using both estrogen and progesterone. However, this risk can vary depending on various factors such as individual health status, family history, and lifestyle. Therefore, it's essential to consult with a doctor before starting hormone replacement therapy to thoroughly evaluate individual risks and benefits. Regular breast examinations and mammograms are also important. There's good news regarding cervical cancer. Research results show that hormone replacement therapy does not increase the risk of cervical cancer recurrence. This is particularly important information for women who have been treated for cervical cancer. In the past, there were concerns that hormone replacement therapy could increase the risk of cervical cancer, but recent studies have not found such a connection. Rather, hormone replacement therapy is being positively evaluated, in that it can greatly improve the quality of life for cervical cancer survivors. However, a cautious approach considering individual medical history and current health status is still necessary. Overall, hormone replacement therapy is greatly improving the quality of life for many women. It shows positive effects in various aspects, from alleviating menopausal symptoms to preventing osteoporosis, improving cardiovascular health, and maintaining vaginal health. Many women are experiencing a more vibrant and healthy middle age through hormone replacement therapy. It's especially helpful for women who have been struggling with severe menopausal symptoms in their daily lives. However, long-term use should be carefully considered. It's good to regularly consult with a doctor and adjust the treatment plan. The effects and risks of hormone replacement therapy can vary depending on the duration of use. While short-term use for alleviating menopausal symptoms is generally considered relatively safe, long-term use requires a more cautious approach. Side effects such as increased breast cancer risk may become greater with longer use. Therefore, it's important to continuously evaluate the benefits and risks of treatment through regular health checkups and consultations with doctors, and adjust the dosage or change the treatment method as needed. Hormone replacement therapy is not applied the same way to all women, but requires a personalized approach considering individual health status, family history, and lifestyle. It can be very helpful for some women, but risky for others. For example, women with a history of breast or endometrial cancer, or those at high risk of thrombosis, may be better off avoiding hormone replacement therapy. On the other hand, it can be very helpful for women who have experienced early menopause or are suffering from severe menopausal symptoms. The method and dosage of hormone replacement therapy can also be applied differently for each individual. There are various forms of hormone preparations such as oral medications, patches, gels, and vaginal creams, each with its own advantages and disadvantages. For example, oral medications are easy to take, but may slightly increase the risk of blood clots as they are metabolized through the liver. On the other hand, transdermal preparations like patches or gels have a lower risk of this but may cause skin irritation. Vaginal creams or rings have less systemic effect, but are particularly effective in improving vaginal health. Among these various options, the most suitable method is chosen considering individual symptoms, preferences, and risk factors. There are points to consider before starting hormone replacement therapy. First, you need to understand your health status and family history well. Check if you have a history of breast cancer, endometrial cancer, thrombosis, etc., and if anyone in your family has suffered from these diseases. It's also important to objectively evaluate the degree of menopausal symptoms you're currently experiencing and the resulting decrease in quality of life. If the symptoms are severe enough to significantly interfere with daily life, the benefits of hormone replacement therapy may be greater. Next, it's good to consider other alternatives along with hormone replacement therapy. For example, lifestyle improvements, dietary changes, exercise, and stress management can also alleviate menopausal symptoms to some extent. There are also non-hormonal medication options. It's important to compare the pros and cons of these alternatives with hormone replacement therapy and choose the most suitable method for yourself. If you decide to start hormone replacement therapy, regular follow-up is very important. When first starting, you'll usually have consultations with your doctor at 3 to 6 month intervals to check the degree of symptom improvement and any side effects. Even after that, you should have a regular checkup at least once a year. At this time, you often receive breast examinations, cervical cancer screenings, bone density tests, etc. Also, if new symptoms appear or if you have any concerns, it's good to consult with your doctor anytime. The effects of hormone replacement therapy can vary from person to person. Some women experience significant improvement in symptoms within a few weeks of starting treatment, while others may take months to feel the effects. Also, side effects such as breast pain, nausea, and headaches may occur initially, but most disappear over time. If these side effects persist or worsen, you can consult with your doctor to adjust the dosage or method of administration. Maintaining healthy lifestyle habits is very important, even while receiving hormone replacement therapy. A balanced diet, regular exercise, not smoking, moderate drinking, sufficient sleep, etc. help maximize the effects of hormone replacement therapy and reduce side effects. Especially, consuming foods rich in calcium and vitamin D and doing weight-bearing exercises are very helpful in preventing osteoporosis. Stress management is also important, and you can try methods such as yoga, meditation, and deep breathing. I'd like to emphasize a few important points again for those considering hormone replacement therapy. First, you must make the best choice for your situation through consultation with a specialist. Together with your doctor, you should comprehensively evaluate your current health status, severity of symptoms, family history, lifestyle, etc., and carefully weigh the benefits and risks of hormone replacement therapy. Second, if you decide to start hormone replacement therapy, regular follow-up is very important. You should have more frequent checkups in the early stages of treatment, and at least once a year after that. This allows you to monitor the effectiveness of the treatment and detect side effects early. Third, it's important to maintain healthy lifestyle habits, along with hormone replacement therapy. A balanced diet, regular exercise, not smoking, moderate drinking, sufficient sleep, stress management, etc. help maximize the effects of hormone replacement therapy and reduce side effects. Fourth, remember that the effects of hormone replacement therapy can vary from person to person. Some people experience quick effects, while others may take longer to feel the effects. It's important to be patient and continue treatment steadily. Fifth, if new symptoms appear, or if you have any concerns, consult with your doctor anytime. Especially if you experience abnormal bleeding, chest pain, pain or swelling in your legs, severe headaches, etc., you should consult with your doctor immediately. Middle age is a very special time in our lives. It's a time when experience and wisdom accumulate and new challenges and opportunities for growth open up. There may be physical and emotional difficulties due to hormonal changes, but if you manage them well, you can live a more abundant and satisfying life. I sincerely hope that all of you find the best method for yourself and spend a healthy and happy middle age. Whether it's hormone replacement therapy or other management methods, the most important thing is to listen to and love your body and mind. This has been Silver Queens. We support your beautiful middle age.